Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Adolescence is a defining phase of life, one marked by rapid physical growth, emotional changes, and growing self awareness. During this time, even minor health concerns can have a deep impact. For instance, missing or lost teeth are not just a dental issue, they can influence teenagers' self confidence, speech, and social interactions. Over time, untreated tooth loss may also affect jaw development, bite alignment, and overall oral health. That is why timely replacement becomes so important, not only to restore function, appearance, but also to support healthy growth and emotional well being. With this perspective, today's discussion becomes both relevant and essential. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we will be discussing an important yet often overlooked topic: the importance of replacing missing teeth in adolescence. And to help us understand the various aspects of this issue, we are truly honored to have with us Lieutenant General Dr. Vimal Arora. Lieutenant General Dr. Vimal Arora stands as one of the most respected and influential figures in Indian dentistry, with a distinguished professional journey spanning over 5 decades, currently serving as the Chief Clinical Officer of Clove Dental, India's largest dental chain. He plays a pivotal role in strengthening clinical excellence while driving strategic expansion across the country. A veteran of the Army Dental Corps, Lieutenant General Dr. Arora served as Director General of Dental Services, Colonel Commandant of Dental Corps. In recognition of his exceptional service, he was appointed honorary dental surgeon to the President of India and also served as a member of the Dental Council of India. An eminent academician, he is a recognized teacher in prosthodontics and implantology and serves as Professor Emeritus at Saraswati Dental College, Lucknow. He has previously held the position of Professor and Head of Department of AFMC, Pune, and Army Hospital, RNR. The highest awarded Army dentist in India, Lieutenant General Dr. Arora is a four-time recipient of the Presidential Award and has also been honored by the Sultan of Oman. His rare distinction includes receiving both the Ati Vishisht Seva Medal and the Param Vishisht Seva Medal. Deeply committed to ethical practice, patient safety, professional training, and preventive oral health awareness, he continues to work tirelessly to transform the landscape of dentistry in India while nurturing talent and upholding the highest standards of care. Lieutenant General Dr. Vimal Arora, THIP Media welcomes you, sir.
Jai Hind.
Jai Hind, sir. Sir, we all understand कि adolescence या फिर teenage जिसको हम बोलते हैं, it's a very sensitive phase, for both the growing child and their parents. And during this period, missing teeth, they can affect the confidence, social interaction, and overall development of the child, which creates an uncertainty about their care. So, to bring in clarity to this concern, I'd like to begin by understanding the root of the problem. Sir, adolescents अपने दांत initially lose ही क्यों करते हैं? I mean, what are the common causes of missing teeth in adolescents?
Thank you, Soumya, for inviting me to talk about this topic. Well, first, let's talk about the genesis of this topic because it's very important. You've taken a very beautiful topic of adolescence.
Ji, sir.
Now, adolescence is never ever discussed in any forum. So, congratulations to you for picking up a very, perfect topic. When we talk of Indian scenario, from 10 years to 19 is the time when we say that that's the adolescent period, and the
Ji,
treatment plan and the care and the worry factor for the parents has to be very different than any other age,
हाँ जी,
because people get confused. They will still go for the same type of treatments, but that is not possible, probably, or not advisable in adolescence. So, when we talk of adolescence, let me put it first: three types or three periods we talk of adolescence:
जी,
early, mid, and late. So, when we say early, then we're
जी,
talking of 10 to 13, mid 13 to 15, and then 15 to 18 or 15 to 19. Depends on,
जी,
various, because India is very huge, depends on
हाँ जी,
various ethnic groups. But 10 to 19. Now, your question is reasons for tooth loss.
जी,
So, two reasons. One is the genetic disposition. That is, either we call it, hypodontia, or we call it agenesis in our medical terms, means that some teeth are genetically missing. That's one.
हाँ जी,
Number two is trauma or injury, some
जी,
kind of injury which takes place, or in the sports it takes place and child loses a tooth. The third, which is most worrying, is the dental disease,
जी,
which is the most common, is the tooth decay in this age. Gum
जी,
disease is not that common, but it is tooth decay. So
जी,
primarily, I'll say that these three important things which will be responsible for giving a tooth loss or missing tooth
जी,
in this age group.
जी, जी, sir. And now just building on that, why would you say is it important to treat missing teeth during adolescence rather than, waiting until adulthood?
So, why treat a missing tooth in adolescence, or why not wait?
Yeah.
Because to understand this, we must understand two things first. That
जी,
is, our permanent teeth start coming up by the age of 6 years. We
जी,
have milk teeth which have all come up by the age of 2.5 years.
जी,
So, up to the age of 15 or 16, we call it a mixed dentition stage, when a person has both milk teeth and permanent teeth.
हाँ जी,
Now, when you have some teeth which is lost and you do not replace that tooth, some very major problems come up. If a
जी,
tooth is lost, and if it is a milk tooth, then the permanent tooth, which is coming right at the bottom of that, will not be able to come up because the space will get closed. Teeth in our jaws are constantly moving
जी,
forward and upwards or downwards to fill up the places, because nature has given this kind of a scenario to humans, that
जी,
the teeth continuously move and they come in contact with each other to chew your food better and to give your jaw a particular shape. So, the
जी,
first and foremost is space closure.
जी,
Number two, the permanent teeth may not be able to erupt and they will get stuck in the bone.
जी,
Number three, your occlusal imbalance takes place.
okay,
Number four, you may have some joint problems, that is your jaw joint problems. And then comes the larger problem which affect you, that is your facial growth doesn't get properly guided,
right,
or you develop malocclusion. That means you develop irregular teeth, or you get, crowded teeth, or you get a narrow arch, or you've got a deep arch, all kind of problems which take a lot of money to get corrected and a lot of time. Then function
right,
gets impacted. And of course, if you have a front tooth missing, then psychological, severe consciousness comes up in this. So that is something I will sum it up, that this is what happens and this is why you should get treated.
right, sir. And given that, we have this wide spectrum of, repercussions that a child might undergo if, the missing teeth are not timely addressed. So, from a parent's perspective here, when should they consult a specialist such as a prosthodontist like yourself for both, for the tooth replacement in adolescents here?
So thank you for introducing the term prosthodontist. So let me tell my viewers that prosthodontist is somebody who does the replacement, who saves the teeth and who replaces the teeth, who is constantly functioning to create your bite, your occlusion, your balance of the occlusion, and who is responsible to have your jaw joint in the perfect health. Prosthodontist has multiple functions, including maxillofacial prosthodontist, as well as, now prosthodontists are also rehabilitating the total occlusions.
Yes,
When
sir.
should you see? As soon as possible.
Ji.
Because when you have a tooth loss,
Right.
you will have bone loss. Now, this
Ji.
is very important to understand that bone is only there if the tooth is there.
Right.
Now, you will say a very great similarity between an infant or a very young child or an old person because
Anji.
both of them do not have teeth, so they
Ji.
don't have the bone which supports the tooth.
Right.
It is the jawbone which supports the tooth. And if
Ji.
you don't have teeth, the jawbone is just not there.
Anji.
And if you look at it from a prosthodontist's eye, then I will say if you don't have your back teeth, within a year, you will have a considerable amount of bone which will go down.
Yes.
So whenever a tooth is gone, the bone goes. And whenever the bone goes, your face looks sad or the face looks prematurely, aged. So that is
Yes.
why we say look at your dentist or a prosthodontist, preferably as soon as possible.
Ji. Ji, sir. And at this stage, once the parents have reached out to a dental expert, how would you say is the treatment planned for teenagers?
Thank you. Because treatment plan here will come for adolescents.
Ji.
So adolescents treatment plan is different. Now this topic has not been discussed by me for many years now. I'm very happy that you have asked. See, let's understand the adolescent age.
Ji.
Now, adolescent age is that the jaw growth is taking place at this age.
Ji.
So your upper and lower jaw bones are growing.
Anji.
You must understand that the dentist must take into consideration that your jawbone is growing. So certain
Anji.
types of tooth replacements will not be or should not be done at this age. So
Ji.
if somebody suggests that let's do an implant for somebody whose jaw is still growing, I will
Right.
say, please, please, no, it's not
Ji.
indicated, which is
Ji.
not known to the general population at all. And they will say, oh, my child's one tooth is missing. I'll go and get an implant. No, for God's sake, no, because his jawbone growth has not yet fully taken place. We cannot talk about this. Now when we say that jawbone growth, then we will say that probably for boys and girls, the age is different and when we say that age is different, what are we meaning? We are talking about, let's say, 15 to 16 years for girls, and for boys, we are talking about 18 to 19 years. So that means if it's a girl who is in adolescence and who needs a permanent replacement, I'll say, all right, we can go for an implant or some kind of a permanent replacement, which can be fixed partial denture or a bridge.
Right.
But for a boy, probably who is 16, I'll say, hold on, don't go for a permanent replacement for him as yet. Let his bone growth take place. So, very clear indexes are available of the growth or the maturation stages of the people. So,
Right.
when we're talking about, then normally people measure it from the cervical vertebral maturation age. That is what
Right.
it is generally looked at, or
Ji.
we also call it the skeletal maturity. So
Okay.
when we are talking about these things for adolescents, then
Ji.
we are understanding it today better
Ji.
that Can every kind of tooth be replaced by an implant for an 11-year-old? No, please. No, cannot be. Can we
Ji.
give a fixed bridge to an 11-year-old? No, you cannot. So, what
Yes.
kind of a denture replacement will you do for a early adolescent or a mid adolescent and a late adolescent? Late
Ji.
adolescent, there is no problem for boys and girls. You
Ji.
should go for the best. That is fixed
Ji.
teeth, implant, or a bridge. But
Done.
for when we come to mid adolescent, I will say max you can go for resin bonded
Ji.
bridges or resin bonded partial dentures, which are fairly good and there is not a problem. But when we come to the absolute, the so-called early adolescent, then we are definitely going to go for some kind of a, I'll say either a flexi denture or some kind of a, a removable denture, which
Yeah.
does not restrict his jaw growth.
Correct.
So what I've laid down here is jaw growth, the
Ji.
ears, and
Ji.
what should be the best replacement for a person and different age groups of the adolescent. I hope this serves some purpose for you.
No, absolutely. I think it was very enlightening, even for the parents, who are actually struggling to bring in their kids to a dental expert here. And I think once the treatment is done, I personally feel that it's not always the dental expert's responsibility to maintain the treatment modality advised or addressed or whatever they've been recommended. Uh, so, sir, what oral hygiene practices would you recommend that, adolescents should follow after the tooth replacement is complete?
Thank you very much. When I was studying 1971, and we were taught that the conventional acrylic denture, that is the replacing denture, which is acrylic
And
denture, we used to
Ji.
call them um, slow, painless tooth extraction forceps. That's what we used to
Oh,
call.
Acha.
Because when you get an acrylic denture and
Mhm.
use it as a permanent replacement, then that denture collects a lot of muck inside and people don't clean it
Ji.
because the dentures of whatever kind you are using, they have to be cleaned very thoroughly with a conventional toothbrush under running water and you want to dip it in anything, I don't mind. But you have to keep them clean because when you don't keep them clean, not only the surrounding or the adjoining teeth get into very severe problems of gum disease, but also your oral skin develops
Right.
some kind of a fungal infection. I have seen profound fungal infections in mouth of people who have not been keeping good oral hygiene with the removable dentures. Now,
Okay.
when it comes to keeping your oral hygiene in the best way for a bridge, then it is different. You will
Ji.
definitely use a interdental floss. Now, flossing is a recommended method for tooth cleansing today. Of course,
Ji.
I'm not talking about brush because by and large, I see that our parents have done a good job and still are doing a good job.
Ji.
Instill that habit of brushing twice a day amongst our kids. So, leaving that aside and understanding that that is already done, I'm
Ji.
rather going to say that you need a dental floss and
Ji.
that dental floss, you should be trained how to use it because dental floss is the only one which can take away the food particles from between teeth. Because whenever you have a fixed bridge or you have a resin bonded acid etched bridge, both of them will need dental floss cleaning. And the last
Right.
will be the interdental brush because these are definitely needed today. So if you have got an implant needs much more oral hygiene measures than any other type. And
Right.
you will need dental floss, you will need interdental brush, and you should also use a mouthwash. And I think you'll be able to maintain the dentures whichever have been given to you and they'll last you for the lifetime.
Okay. Beautifully put, sir. And now coming on to the roadblocks here again. In India, we have numerous cultures. We have people with a lot of beliefs, traditional beliefs in particular. So, what common myths about tooth replacement in teenagers do you think can cause a delay in their treatment?
So, I know I've heard during my college days that, ladies used to be telling that for every pregnancy, I will lose two teeth or three teeth.
Yeah.
So, and also there were a lot of myths around, that if you get your tooth extracted, will affect your eyesight. And if you are wearing and what is even today is I've got one tooth lost. I don't need anything. I don't need a replacement, which is the most common and most damaging. The
Ji.
other two myths have been by and large addressed too by the health, but I've just got a single tooth missing, so why should I get any replacement? Is something which I will say that it is as much necessary to replace one tooth as it is a greater number of teeth. I will say that if you have got a single tooth missing, you should get it replaced as soon as possible. You should
Ji.
not delay. Because the moment you have a tooth missing, the food starts getting stuck in the adjoining teeth. And the moment you say, oh, I have to use a toothpick after food, you need definitely a care of a prosthodontist.
Ji.
Food should not be getting stuck between the teeth at all. That means there is something wrong. That means the contact points, contact areas between the adjoining teeth and the opposing teeth is not perfect. And the moment you have food lodgements, then you have bacterial growth there. You have, the food getting rotten, foul smell, and gum disease starting, causing bone loss. And before you realize, there is pus formation there, which is spreading.
Ji.
And dental disease does not cause pain, especially the periodontal disease during its initial days.
Ji.
Tooth decay still gives you some indication of sensitivity to hot and cold or sweet, and you know that something is wrong. So, my dear friends, what we need to do is even one tooth loss, one must get it replaced immediately as soon as possible by the best way you would like to get it done.
Ji. Ji, sir. And now, from a fairness perspective, how does better dental health awareness, help teenagers take part in their own treatment decisions?
All right, good. Thank you. So, see, the girls go through a lot of hormonal changes during this
Ji.
time, during pubertal growth and
Ji.
during the menstruation. And, that puberty creates huge amount of changes in the body. And they're
Ji.
very prone to certain changes in their gums.
Ji.
Now, if the gums are healthy and they don't have any deposits, no calculus, no plaque, no bacteria, they will not develop any disease. It will just happen and it will be fine again.
Ji.
The hormones go up and go down. It does not cause any lasting damage to the gums or bone. Now, think about the other condition where a lady is going through the hormonal changes and his mouth is full of calculus or deposits or bacterial presence.
Ji.
Now she will have a lot of problems in her mouth because her bone will start getting destroyed. So
Yes.
that is one. Number two, we are fully aware that, and WHO has been talking about this always, that if you have pus anywhere in the oral cavity, now you don't know that you have a pus, only the dentist can tell you. Many times it's only known when you get
Yes.
an examination done by the dentist that you have pus. When you
Ji.
have pus in your body or in your gums, your body is constantly fighting that. And you're
Ji.
not growing up that well. It affects your growth. And when it affects your growth, it causes you a permanent damage. We have also known from WHO that ladies who have severe gum disease will definitely have, low birth weight babies or premature deliveries. So that is another issue which comes up with a lot of our so not so educated girls who are into, in their adolescent and going for pregnancy, and they come up with these major problems without realizing that this is coming up from their gum disease. So there is the literacy about oral health. I think we are pioneering in that, and we are continuously talking about dental health literacy to people through various such forums. And thank you for this forum. That's what we are constantly doing.
Yes, yes, sir. So I'm just simply going to summarize this wonderful session with one final question here, sir. That how can parents support their teens or the growing adults' oral hygiene regimen?
Yeah, I think parents should find time for the kids. That which
Yes,
is hard to come by these days.
yes,
So parents have to show them how to do. Parents have to do themselves and show the kid how to do. So if they can show the kid how to do and do it for them initially and slowly put them on to a regular brushing, the oral hygiene, the mouthwash, the mouth rinsing, the mouth goggles from an early age, that will make sure. And your child will thank you for that for the rest of his life, that I have beautiful teeth because of my mom, dad. And today, with the type of food what kids are taking, I'll say that parents have to teach them how to use a dental floss, because without dental floss today, you cannot clean your teeth. And somewhere where you have a prosthesis or a denture or a replacement, then you should know how to clean that, and to maintain that kind of a health is very important. That's one. Number two, any kind of deleterious oral habits like grinding at night,
yes.
keeping the mouth open while sleeping,
Ji.
or nail biting, or chewing the lips. These cause immense damage in the developing dentition or the developing teeth or the growth of jaws. For example, if you are grinding your teeth in the night, you are taking away the enamel, which is never replaceable. And parents must do immediately something and go to the dentist that my child is grinding his teeth in the night. Can you do something? Yes, we can do. Oh, my child is having his mouth open. He's breathing from his mouth whole night with his mouth open. Oh, yes, we must do it. Otherwise, his nasal passages will not grow properly and he will have, a very narrow arch, maxillary arch and mandibular arch, that is upper and lower arches. So I will say that how can parents support their teen? I think they can support him in every possible way and see if the child is developing into something which he should not, and guide us. That means us dentists to help their kids to have better teeth for their life.
Right, sir. Right. And on that wonderful note, I really appreciate your presence with us today, sir, and I'm hoping that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us. It's really been a pleasure.
Thank you very much, and Jai Hind, and it's very nice to have talked to you, Soumya. Your questions have been very, very prompt and absolutely perfect. Thank you so much. Jai Hind.
Thank you so much, sir. Jai Hind. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.